Hi, this is Jessica DeMassa. I'm here at the HISA Studio at HIC 2017, and I'm with Kudzai. Can you please introduce yourself for everybody watching?
My name's Kudzai Kanhutu. I'm a doctor, so infectious diseases physician. I also work in telehealth, refugee and immigrant health.
Fantastic. So let's talk about telehealth for a minute. What's going on in telehealth in Australia right now? Give me a little bit of a pulse.
It really depends because of the complexity of our health system, state, federal funding, etc., community level care. It really depends where you go for the answer that you'll get. So for some of the larger states or the more geographically dispersed states, they have a really strong tradition and a history of telehealth and being really ahead of the curve. So Perth, Western Australia, for example,
Sure.
Queensland, even New South Wales, they get a lot of runs on the board and they find really novel ways to use telehealth or do telehealth, so for education purposes, research even, as well as clinical care. Whereas in smaller states like Victoria, we have begun to do telehealth, but I guess the diversity or the repertoire is maybe not as full or as diverse as it is in some of those larger states.
Now, what kind of role is telehealth playing? Like, is it basically providing primary care, or is it providing more emergency type care? Does that also vary by state?
Really varies by state and by health service and by need. So, telehealth really speaks to that old adage of necessity is the mother of invention.
Yes.
So if you find, in rural New South Wales or the Western districts, there are some areas where they have used it for emergency care, where they have smaller towns that don't have an emergency physician there all the time, where a GP really needs to be able to, or a primary care team needs to be able to dial into a larger regional centre in order to get the support that they need. It might be for education purposes, so you're wanting to connect teams, for example, a dialysis unit that's out in the smaller community that needs to be able to connect with a specialist who might be somewhere else. So there are a lot of really diverse models in terms of where it's popping up. So in Victoria, where I am, our current focus is on outpatient care within hospitals. So regular specialist appointments and just allowing people to have more of a choice around how they enter the service or how they attend their appointments.
Now, are there any barriers to adoption that you've come across? Like, what seems to be some of the blockers that are in the way here from a wide uptake?
I think the blockers are, if I say, if healthcare were a business or a true business, most businesses have a time of the year around about now, end of financial year, where you will do a stock take. You shut the place down maybe for a few days and you actually rake over the coals and see how you can do things differently.
Right.
We don't have that liberty in health, so we're always in a state of perpetual motion.
Right.
And that inability or that to be able to stop, reflect and do a big bang type of service redesign, I think becomes a bit of a barrier in and of itself. So people have the will and the desire, but what you tend to find is you find small mobile groups of people who pick up on a theme, pick up on a telehealth agenda, move with it quickly, as opposed to a whole organisation in one block saying we're going to do a complete revision of how we do outpatient care, and as of May 1, everybody will be doing telehealth because there'll be individuals there who have varying digital health literacy. And literacy is something I'm really keen to build on. People's comfort with tech. Because sometimes you'll speak to people and you see there's this kind of shrinking, what do you mean I'm going to have to do that?
Right.
And there's a lot of behavioural psychology around it. Some people don't actually like, so if we're talking about video conferencing, for example, they don't like seeing themselves on video. But if you said to them, our telehealth, all we want you to do is to actually, we're just going to be getting people's blood sugar levels beamed in and we'll just be looking at results. Very comfortable then.
Right.
It's so that type of telehealth, people are comfortable. That asynchronous, I'm getting results in, I'm reviewing them, people are comfortable with that type. But the more intense interpersonal ones that require a lot of workflow analysis, workflow redesign, scoping, training, it's hard to do because we're always moving.
Well, yeah, I mean, that really integrates it into the care process and actually uses it as a delivery vehicle for care.
Yeah.
So talk to me about the patients. How are you experiencing patient uptake with this? Are they excited about it or are they reluctant as well?
The patient side of it is, I think that it's that sometimes you have a disjointed conversation when we talk about the ways that we actually engage with patients. So we have a lot of steering committees, and even within those steering committees, what you tend to find is that we end up with professional patient advocates. So patients who know the health system really, really well, and sometimes almost lose that that fresh view, fresh perspective of somebody who doesn't know the health system well, who'll actually come in and say, you know how you recommended telehealth, did you think about some people who maybe actually just want to be in the room with somebody or who don't want to have to upload their results, who actually want to do things differently? So some patients, of course, really receptive, and you'll find that variation in any group that you speak to in the hospital. Some really want to do it, really love it. The patients who have the most to lose by having to do things in the standard way are obviously be the ones who will put their hand up and say, yeah, we really want to do it. And then you find people who do want to do it and then do it and maybe change their mind, but there's a lot of variability. But I think one of the biggest challenges is trying to reflect that diversity in the way we actually try to engage patients, to understand that what are the reasons that people are maybe really super keen to do it, and what are the things that will make them less keen to do it, and how do we build a comms strategy that accounts for all of that. And that's the real challenge, I find.
Fantastic. Well, thank you so much for joining us here in the HISA Studio. It's wonderful to hear a little bit about telehealth and how the status of it really here in Australia. Thank you so much for providing your insight. I'm Jessica DeMassa here at the HISA Studio for HIC 2017. Thank you.